Hello, my name is Mary. Welcome to the Labor and Delivery Unit as a new grad nurse. I am going to walk you through the first stage of labor, which is the first of several stages of labor that a woman would go through. So, the first stage of labor is the longest onset of the labor stages, and it starts with uterine contraction and ends with the complete cervical effacement and dilation. It is longer for first time mothers than women who already had children, and there are two phases. The latent phase extends from the onset of labor and is characterized by regular painful uterine contraction that cause cervical dilation. And then the active phase is the greatest rate of cervical dilation that begins at 6 centimeters and ends with complete cervical dilation at 10 centimeters. Now, we educate the pregnant woman to call when they have any contraction going on close to the term of their gestation. So a woman will call, and that will start our assessment for the labor stage. So she will call to confirm the validation of the contraction, and if we are able to tell that the contraction is regular and not irregular, we would ask her to come in. When the woman comes in, we are going to do some prenatal data collection. This is collected to ensure that the woman's risk is identified. We would also do the amniotic membrane status. We would determine the amniotic membrane status during the triage process. And the amniotic membrane status would include the spontaneous membrane rupture and bloody show. The bloody show will have a pink characteristics, and it will have a sticky feeling to it. We want to distinguish that from any uterine bleeding that may occur, because it's very important to differentiate the bloody show from any uterine bleeding that may be a complication of their pregnancy. We would collect vital signs as well. The vital signs would give us a baseline of what the woman of a baseline of the for the woman. It will give us a baseline for the woman. So the early labor phase will have vitals check every 30 minutes to an hour, and then the active phase will have the vitals taken 15 minutes to 30 minutes. And then would do some Leopold maneuver. The Leopold maneuver is an abdominal palpitation, and is used to estimate fetal size. It will answer three questions, which include which fetal part is in the uterine fundus, where is the fetal bag located, and then what is the presenting fetal part. We want to see if the head is coming first with the baby, or if other part of the body is presenting. And then we would check for the pattern of the fetal heart rate and assess it. We'll also do a uterine contraction, which is effective when it has a regular activity to it. And then we'll do vaginal exam. The vaginal exam will determine if the woman is in true labor and if the membranes have ruptured. We would also collect some lab, and this lab would include urinary analysis. Urinary analysis would determine the hydration status, the nutritional status, and if the woman has any infection going on, so we can treat it. immediately. We'll also take blood cultures that would include the WBC, the RBC, and hemoglobin level. This would help us to ensure that, for instance, for the hemoglobin level, we want to know if the woman may need any blood transfusion as the labor process goes on or not, after she has delivered the baby. We would also encourage that there's during the whole process of the labor, voiding takes place every 2 hours, and we don't want any distended bladder, because that would impede the descent or like the coming down of the baby's presenting part. It will slow or stop uterine contraction and lead to decreased bladder tone. So we encourage the woman to void every 2 hours. Ambulation and position is also encouraged. Upright position if the woman can endure and if the woman can tolerate it, and mobility may be more pleasant for the woman. These interventions improve uterine contraction intensity, and it helps the labor process to be shorter. It also helps to have a decreased need for medication. Now, supportive role is also very vital for the psychological well-being of the mother. So we encourage that any partner or spouse that would help the process go more smoothly is made available. So if this support system is available, it's very ideal for the woman to reduce anxiety or stress that may come with the labor. A doula is also a supportive role that would also make sure we have, because they are the labor attendants, a female labor attendant, who would help with the process of the labor and delivery to go on smoothly. So we encourage that as well. And as nurses, would also be a huge supportive role for the pregnant woman. We would give the support the woman needs through the whole process. I hope the information I provided are very helpful. Please let me know if you have any questions, and I'll be happy to answer them. Thank you.